Tibia nail is used for proximal and segmental fixation, stabilizes wide canals, articular splits, and complex shaft fractures. Distal and pathological care secures fragments near the ankle and treats non-unions or tumors. Suprapatellar precision prevents proximal deformity and ensures accurate alignment via the extended position. Tissue and joint safety protects vulnerable entry site skin and shields patellofemoral cartilage using sleeves. Expert Tibia nail enhances construct stability to reduce the risk of secondary malalignment. Multidirectional screws provide secure fixation in short proximal and distal segments. Use 4.4 mm locking bolt for distal fixation and 4.8 mm locking bolt for proximal fixation. End cap mechanism ensures angular stability to the most proximal screw for reliable fracture alignment. Available in diameter of 8 to 12 mm and length of 255 to 375 mm with 15 mm increments. Position the patient supine on a radiolucent table. Position the radiographic ruler alongside the tibia to measure nail length. Slide radiographic ruler to measure nail diameter. With the injured leg in full extension, make an incision 4 cm proximal to the superior pole of the patella. Splits the quadriceps tendon in its mid-substance. Blunt dissection can be used to loosen the patella in the suprapatellar pouch. Lift off the patella anteriorly. Identify the entry point in line with the axis of the intramedullary canal and with the lateral tubercle of the intercondylar eminence in AP view. Assemble the protection sleeve handle and 16/14.5 mm protection sleeve by pressing the buttons on the side. Attach outer protection sleeve to protection sleeve handle by rotating clockwise. Insert the 14.5 mm peak trocar through the protection sleeve and lock it by rotating the knob on the protection sleeve handle. Insert the protection assembly into the knee joint gliding between the articular surface of the patella and the trochlea of the distal femur. Rotate the knob on the handle, letting the trocar slide. Advance the assembly till the protection sleeve reaches the tibia. Retrieve the trocar. Place the 14.5/3.2 mm centering sleeve through the protection sleeve. Insert the 3.2 mm threaded tip guide wire through the center hole of centering sleeve approximately 8 to 10 cm in the tibia. Confirm placement under fluoroscopy. For correction, rotate the centering sleeve on its position to insert a second threaded tip guide wire through side holes. Remove the first threaded tip guide wire once placement is confirmed. Retrieve and reinsert the centering sleeve, making the position of the second threaded tip guide wire from side hole to center hole, sliding the assembly. Rotate the handle around the guide wire and insert the threaded tip guide wire through the handle in the femur. Retrieve the centering sleeve, securing the guide wire at its place. Use an entry reamer with quick coupling T-handle to break the cortex of the tibia until the stopper reaches the protection sleeve. Introduce reduction device to align the fractures. Advance the 2.5/3.65 mm guide wire with ball tip through the reduction device and retrieve the reduction device. Use the AO connection flexible reamer shaft with a suitable reamer head over the guide wire. Maintain reamer head 0.5 to 1 mm larger than nail. Ream and retrieve the flexible reaming shaft in forward rotation only. Assemble the selected size of Expert Tibia nail with the insertion handle. Place the nail onto the insertion handle, matching groove until flush. Fix the nail with the long nail holding bolt using universal driver for nail holding bolt. Glide the nail assembly over the guide wire into the bone. Retrieve the guide wire with ball tip. Attach the connecting shaft and hammer guide shaft onto the insertion handle. Connect the sliding hammer onto the rod and apply gentle blows to seat the nail properly. Keep the proximal nail end 2 to 4 mm within the tibia. Disconnect the hammer and unscrew the connecting shaft and hammer guide shaft. Attach the distal aiming device and secure it with bolt for distal targeting device on the insertion handle. Match the marking according to the length of the nail used. Insert the 5.2 mm drill sleeve for positioning rod in the proximal hole at distal end of the distal aiming device. Drill with 5.2 mm drill bit plain shank / Jacob chuck end through the drill sleeve. Retrieve the drill bit. Use 5.2 mm T-handle drill bit with flat end to clear the debris. Retrieve the T-handle drill bit and 5.2 mm drill sleeve. Use positioning rod and stabilizing device to maintain the position of distal end of the nail. Attach the distal aiming arm with distal aiming device and fix by screwing the bolt for distal aiming arm. Insert the 10/8 mm protection drill sleeve and 8 mm trocar in the hole of the distal aiming arm. Tap the trocar and retrieve it. Insert 8/4 mm drill sleeve through the protection drill sleeve. Use 4 mm drill bit plain shank / Jacob chuck end to drill a bicortical hole in the bone. Retrieve the drill bit and 8/4 mm drill sleeve. Use depth gauge measuring up to 90 mm to measure the length of 4.4 mm locking bolt. Retrieve the depth gauge. Use hex 3.5 mm screwdriver with T-handle to insert measured length 4.4 mm locking bolt through protection drill sleeve. Stop once the marking on the screwdriver reaches the protection drill sleeve. Retrieve the screwdriver and protection drill sleeve. Repeat the same procedure for the second medial to lateral locking bolt through distal aiming arm. Once medial to lateral locking bolts are fixed, unscrew the bolt for distal aiming arm and retrieve the distal aiming arm. Repeat the procedure of placing the two anterior to posterior 4.4 mm locking bolt through distal aiming device. Once all the distal locking bolts are fixed, detach the stabilizing device and retrieve the positioning rod. Unscrew the bolt for distal targeting device and retrieve the distal targeting device. Attach the proximal aiming device for 4.4 mm locking bolt onto the insertion handle using bolt for proximal aiming device. Repeat the procedure of inserting a 4.4 mm locking bolt in the proximal dynamic hole of the nail through proximal hole of proximal aiming device. Screw in the compression device from the proximal opening of the nail through nail holding bolt to reduce the fracture. Stop once fracture reduction is achieved and screw out the compression device. Repeat the procedure of inserting a 4.4 mm locking bolt in the proximal static hole of the nail through distal hole of proximal aiming device. After placing both the 4.4 mm locking bolt, unscrew and retrieve the proximal aiming device for 4.4 mm locking bolt. Assemble the 11/8.6 mm protection sleeve for 4.8 mm locking bolt with 8.5/3.2 mm drill sleeve for 3.2 mm drill bit and 3.2 mm trocar. Insert the assembly in the insertion handle. Tap the trocar and retrieve it. Use 3.2 mm drill bit plain shank / Jacob chuck end to drill a unicortical hole in the proximal tibia under fluoroscopy. Pressing the 8.5/3.2 mm drill sleeve to the bone, Move the stopper on the drill bit till it reaches the drill sleeve and lock it using hex 3mm Allen key. Markings on the drill bit provides the measurement of 4.8mm locking bolt. Retrieve the drill bit and drill sleeve. Alternatively, use depth gauge to measure the length of 4.8mm locking bolt. Use hex 3.5mm screwdriver with T-handle to insert measured length 4.8mm locking bolt through protection sleeve. Stop once the marking on the screwdriver reaches the protection sleeve. Retrieve the screwdriver and protection sleeve. Attach the proximal aiming device for 4.8mm locking bolt onto the insertion handle using bolt for proximal aiming device. Repeat the procedure of inserting the 4.8mm locking bolt through the proximal aiming device in distal and proximal oblique holes of the nail. Unscrew the bolt for proximal aiming device and detach the proximal aiming device for 4.8mm locking bolt. Use universal driver for nail holding bolt to unscrew the nail holding bolt to release the nail from the insertion handle. Use hex 3.5mm screwdriver with T-handle to insert the end cap through the outer protection sleeve handle assembly in the proximal opening of the nail. Retrieve the screwdriver with T-handle and insertion handle once end cap is fully tightened. Retrieve the threaded tip guide wire from femur to remove the anchor from protection sleeve handle. Retrieve the outer protection sleeve handle assembly. Tibial shaft fracture reduction using Oxion's Expert Tibia nail following Suprapatellar insertion is completed. Keep incisions dry and use an ice pack regularly to minimize swelling and pain. Start quad sets and ankle pumps immediately to maintain muscle and blood flow. Begin gentle knee bending and straightening early to prevent joint stiffness. Follow your surgeon's weight-bearing limits to protect the nail and bone. Complete physical therapy and avoid high-impact activity until X-rays show full healing.